So you can adjust the tables to your height, to your liking. I'm actually going to have the patient swing their leg on over this way, which will make it a little easier for me. So like that, I'm not bending down and the patient doesn't have to assist. So if you lay it down like that, it's perfectly fine. This doesn't have to go up. For the purposes of training, we're gonna leave her sock on. Actually, you can use a stockinette if the patient doesn't have a wound. If they have a wound, it's always best to use the Unnaboot directly to the skin because it provides a good healing agent with the zinc oxide. In this case, we're gonna use this so we don't get her all dirty and nasty, which is pretty smart. You can take this and roll it up just like this. Makes it a little easier to put it on the patient. I learned this in a casting clinic that I went to. And just roll it on up to the patient. Leave a little extra. All right. There's two different brands. This one, no shade to Medline, but it's not that great. And their material, the gauze itself that it's applied on, it's like very weak and like it's a different type of material. So we're gonna go with the Econo paste, the one we prefer, the good stuff, because we only want the best for our patients because we actually give a damn. So be careful. It has this white paste in it. So you want to be careful that you don't get it on you because it is staining. If you wash it or clean it quickly off your uniforms, then it'll come off. If you leave it on, it won't. If you get it on sheer, you can use a little bit of like oil and things like that and it'll come off. Roll twice. Make sure you cover your meds under here. I do my figure 8. Come down, cover your heel. Come around, cover that heel. Get that figure 8. Some people can wrap this all the way up and it's perfectly fine. It does the same thing. We do it here preferred to what the physician likes, which is you fold to allow that extra compression. On the bottom portion, it's 25%. Once you hit up here, it's gonna be 50% coverage. So right now it's that 25% coverage. If you keep it nice and tight, that's what he said, it'll work better for you in the manipulating of this gauze. All right, so you come on up, keep it tight. Make sure that your ridges are nice and clean, right? Because this is considered like a soft cast. So if the patient's skin is very thin, you know, regardless of age, some patients based on, you know, their disease or their lifestyle, it can actually break their skin. So be very careful. Now to that 50% coverage. You see how it was a little bit? Now it's a little bit more. 50% coverage. Hold it. And just angle up. Lay it down. Angle up. Lay it down. And come back around. Don't waste material. Just finish it all up. Some people are lazy and don't want to keep doing it and they'll just cut this off. I would consider that to be lazy. Because why not just use the whole material, right? There's places in the world that don't even have access to plain medicine. So use what you got. Be proud of your work. Make it look pretty. They gotta stay with this on typically 3 to 5 days. You can leave it on up to a week. There's a nice little fold here. I fold my last portion like this because when we go to remove this Unnaboot, flatten it all out, you can actually take it apart on the bottom, right in the dead center. So fold this up because this patient has no wounds. If there was wounds, then we would actually be applying this Unnaboot directly to the skin. If it's thin skin as well, I would apply the stockinette because when that Unnaboot gets dry and stuck to the skin, it actually gets very hard. And when you go to take it off, I would use some saline to wet it up a little to try to reduce it from sticking on that skin. Same thing, you're gonna go around, you're gonna cover your heel, you're gonna do your figure 8. I do a figure 8 on everything, right? I'm no doctor, but based on all of the classes I've taken, this is the best way that I've learned how to do my stuff. Make sure you cover your heel, work your way up, Fantastico. Where you finish off, you start back up. Always roll against the skin, against the body. Makes it easier. And this cling conforming gauze Curlix is all known to be the same, right? It's typically used so like that gauze, that zinc oxide medication is not draining straight through, and it won't get on patients' floors when they're walking at home. It won't get on their material. And then you use Coban. Coban, C, compression, best way to remember that. 4 foot first. Coban is not easy to manipulate as much as everything else, so of course you'll have some folds and creases. Best thing to do is just to pull up, go around, pull down, go around, unroll it. You don't want to roll and pull like that because it's going to tighten it too much and they could lose their circulation. All right, go around, release them, go around, make sure you cover your heel. It's easier to pull and then just lay. Pull and then just lay. Pull and lay. And then at the end, you'll see at the end on the Coban, it has a little fold. Open it up, and Coban is self-adhesive. Put it on, and that to you, my friend, is an Unnaboot. That's pretty.